In 2007, in a North Carolina hospital, a young woman in her 8th month of pregnancy visited her new obstetrician for a prenatal checkup. He ordered a complete round of baseline tests, including HIV, hepatitis C, and CBC. The hospital drew her blood as it served as the collection site for the lab interpreting the results. 10 days later, the obstetrician advised the woman she had tested positive for HIV. He referred her to an infectious disease OBGYN who started her on antiretroviral medications to lessen the chance of passing HIV to her baby. Within 24 hours, she went into premature labor and was taken to the nearest hospital, different from the one that had performed her blood work. Anyone in the delivery area had to be informed of her HIV positive status, so she had to tell her parents and in-laws. Meanwhile, the hospital began more intravenous antiretrovirals and took more blood tests. Following delivery, the newborn was taken to the ICU and given antiretrovirals as well. 2 weeks later, the woman's obstetrician calls her. She is not HIV positive. The follow-up testing was all negative. He believed her blood had been mislabeled at the lab. Of course, the woman and her husband sued the hospital and the lab. She sought damages for pain and mental anguish. She also feared what effects the unnecessary administration of antiretrovirals might have on her baby.
Patient identification is the very first, and one might say most important, step in providing safe care. As a healthcare provider, you probably think of patient identification first when administering medication or for a surgical procedure. However, correct identification is equally important on the patient, test results, medical records, and, as in this case, specimen label. The Joint Commission recommended a national patient safety goal for 2008, mandating that specimens be labeled in the presence of the patient to help avoid errors such as this one. CRMC policy for phlebotomy and labeling of specimens dictates that all specimens must be positively identified for the type of specimen and its source. Confirm at least 2 patient identifiers such as name and date of birth, along with the medical record number. State the last 3 digits of the medical record number out loud. Compare all collection labels to the patient's armband. Collect specimens in appropriate containers. Label all specimens in the room in front of the patient. Never affix a label to any container before entering the patient's room or outside the room after collection. If manual labeling is required during downtime, the following must be noted at a minimum on the handwritten label and affixed to the specimen at the point of collection in front of the patient. The patient's name, first and last, the date of birth, the date and time of specimen collection, the Paragon ID of the person collecting the specimens, specimen source if appropriate, and medical record number if available. A final check must be performed after obtaining specimens. The staff member obtaining the specimens will compare all specimens to the patient armband and state the patient's last 3 digits of the medical record number out loud. Remember, it is mandatory to scan the patient's armband along with their specimen label to ensure accuracy. Due to the severity of a mislabeling error, the following corrective actions will be administered. For the first occurrence, you will receive a written warning. The second occurrence within a 12-month period earns a 3-day unpaid suspension. A third occurrence within a 12-month period will result in termination of employment. Our specimen identification and labeling policy can be located on the intranet on the Policy Stat icon. Now let's take a look at the incorrect and the correct way of labeling specimens here at CRMC.
Hey there. I'm going to draw some more blood on you, okay?
Again?
Yeah.
I haven't seen you before. Is this your first day?
I'm just helping out one of the other nurses. Okay, you ready for a little stick?
Mm-hmm.
All right, I think we got what we needed. If that starts bleeding, just hold it down real tight, okay?
Accept call?
Yes.
Hey, girl, you will never believe who's here. Sarah's in with her baby daddy, and it's not the father.
I'll be right there.
Okay.
How are you? I'm doing all right. Can you believe Dr. John ordered some more labs on that patient? Gosh. Good morning, labor and delivery. This is Joanna. How can I help you?
This is Shannon from the lab. Can you let me speak to who collected the blood on Veronica Doe and Victoria Doe?
It was me.
Can you let me know if that's correct?
That's not correct. I only collected blood on Victoria. There shouldn't be any for Veronica.
I'm going to send this back up through the tube system and let you fix it.
But I am going to have to fill out the corrective action form and send to your director.
All right, well, just send it up here. I'll fix it.
Okay, L and D.
Hello.
Hey, could you come to my office when you get a minute, please?
Hi.
Hey. So the reason why I want to talk with you is I got a MIDAS report about a mislabeled specimen.
I relabeled some specimens just the other day.
This is our mislabeled specimen form. Whenever we have an incident, we have to fill this out and return it to the lab within 48 hours. You've been here for 10 years. Your patients love you. You're an asset. But this is a serious situation, and this will be your first warning.
Oh, this definitely will not happen again.
I need you to give me the information about how this was mislabeled and sign it, and I'm going to send it back down to the lab.
Okay.
Shannon, here's your corrective action forms.
Thank you.
Hey there, I'm Joanna. I'm gonna take some more blood. Your physician has ordered some more, okay? Can you tell me your name and date of birth?
Victoria Doe, 4888.
All right. Thank you for being patient with us.
Well, thank you for introducing yourself.
Yeah.
McCowan.
Hey girl, I'm in a room. Just talk to you in a minute.
Call me when you're done.
Okay, thanks. Have you otherwise been having a pretty good day?
It's been okay.
Good. Little stick on 3. 1, 2, 3. Wasn't too bad, was it?
No, you're pretty good.
All right, we are all done. I'm just gonna scan your labels in here. Okay, can you tell me your name and date of birth?
Victoria Doe, 4888.
All right, perfect. Let me just check your wristband with these to make sure we'll have everything correct. We do have Victoria Doe, 4888. Let me check your medical record number. It is 456. All right, are you comfortable? Let me just fix this pillow for you, okay? Are you having any pain right now?
No,
Okay. Do you need to go to the restroom while I'm in here?
I think I'm okay for
All right,
now.
I'm just going to put this a little closer to your bedside for you. All right. And if you need me, this call bell's right here next to you. Okay, just press that red nurse's button. Can I get you anything else right now?
Can you put my cell phone a little closer to me?
Yeah, sure, no problem. All right.
Thank you.
All right. Well, give me about 30 minutes for these labs, and as soon as they come up, I promise to come let you know, okay?
Okay, thank
All right.
you.
Mislabeled specimens are a big deal, and these policies are in place to protect our patients and to ensure that we continue to provide the high quality, professional care that our patients deserve and have come to expect. We have a choice every day to make a difference. You are a key in us creating a just culture at Cookeville Regional Medical Center.